We did with Professor Casoli in Bordeaux a double 2 centers prospective study, which will be published soon in a journal, in UK journal. We studied 33 patients, 28 in Bordeaux, 5 in Montpellier, with a follow-up at 12 months, and we assessed the type and the frequency of complications related to NEVELIA. The cases were 30 patients concerned reconstructive surgery with trauma and delayed wound healing in 9 cases, treatment of flap donor site 6, open wound on amputation stem on 5, wound related to skin tumor, melanoma, epidermal carcinoma in 4 cases, a diabetic foot in 2, and other wounds mixed in 4. 3 patients presented with 3rd-degree burns, 2 on the foot and 1 on the hip and buttock. I will show the cases. The first case is a male, he's 75 years old. It's a 3rd-degree burn, which occurred in June 2014. So this is a case of 3rd-degree burn. The wound bed prep, the NEVELIA, the follow-up, and after silicone removal of the neodermis, there is some difference in terms of silicone. The silicone of NEVELIA is a little bit thicker and is more elastic. It means all the staples you put on Integra may transform into sources of infection, which is less observed with NEVELIA. The film is more elastic. So this is a split dermal epidermal graft, and this is the result at 6 months. There's a lot of undermined cavities, the need for amputating the second 2 because of opening of the joint and destruction. The wound is large, uneven, so we needed first negative wound therapy, and 2 weeks later NEVELIA, covered by a skin graft, and this is the evolution of the foot. And you see that when the recurrence came, which is often the case, especially on these patients, it doesn't touch the covered area, but the area which is close to. So it doesn't mean that the NEVELIA area is stronger, but it means that at least is equivalent or less. So in conclusion, I would say that this is a new dermal substitute which has been used in burns, in chronic wounds, in trauma, in skin tumors, and others, with stable scars. So this is so in conclusion, it's a new dermal substitute. The collagen is obtained using a specifically designed freeze-drying process. Some elasticities allow to a better, well, slightly better infection control. The film covering the collagen is more resistant, and as usual, more data is needed. Thank you.